Do you have chronic plantar fasciitis pain that won't go away? If so, this video is for you. I'm Dr. Dave Candy, and in this video, I'm going to show you 7 little known but effective exercises to help you get rid of your foot pain. Now, these exercises are going to affect different parts of your foot and ankle joint complex. So before we get started, it helps to have just a very brief anatomy review so you understand what each exercise is doing. So your ankle is formed by the 2 bones of your lower leg, the tibia and the fibula. Between that, you have a wedge-shaped bone called the talus, and then there's 2 bones that attach to that, the calcaneus, your heel bone, and another bone on the inner side of your foot called the navicular. Past that, there's 3 little cuneiform bones, then your metatarsals, and then finally those join into your toes or your phalanges. So we're going to work from the heel down first, then go more into the ankle joint a little bit later. So this first exercise is to affect the joint between your talus and your calcaneus. That's referred to as the subtalar joint. Now, what that does is it controls the inwards and outwards motion of your foot. It also helps lock and unlock your forefoot. Now, a lot of people will have trouble with their calcaneus not being able to go outwards that way. And that motion is known as pronation. Now, interestingly, a lot of people who have plantar fasciitis, they overpronate or they pronate too much. But you can pronate at the rear foot part of your foot by the heel or the forefoot part. Now, most people don't have trouble going inwards at their heel. That's just the way that the bones of the ankle are formed. But a lot of people do have trouble of getting their heel to go out that way or getting rear foot pronation. As a result, when you're taking a step, in order to get your big toe down to the ground to push off and take the next step, you have to pronate from somewhere. And so you end up overpronating at the forefoot. And so this first exercise is to help get that rear foot pronating a little bit better. And to do that, you just grasp around your ankle bones with one hand and then take the heel of your hand and put it on the inner side of your heel. Now this is going to be just a very small pushing movement back and forth. Just a little wiggle of your ankle. You don't want to turn your toes up and down like that. It's not a very large motion, just a straight pushing down towards the floor motion like that. If you feel a lot of motion, you're probably not doing it right. This is a very tiny motion, but it's an accessory motion of your ankle that's important to proper function. So do this for about a minute or so. This just helps get your subtalar joint, the joint between your ankle and your heel, moving a little bit better. Now, after you've done that, we're going to move down to the next joint, and that's the talonavicular joint. And so that's the joint between this wedge-shaped bone here and the navicular on the inner side. You've got some nerves that run under here, your medial plantar nerve, and that often can mimic plantar fasciitis symptoms. You also have the plantar fascia that runs down on the underside of the foot, as well as some little muscles that go right under that big toe. So this is a really important joint. And if you do overpronate from the forefoot, a lot of times that navicular will drop down some, and it puts pressure on the structures that are underneath it. So to help with that, put your thumbs on the navicular and you just slide off the heel. It's that first little bump that sticks out. You'll know you need to do this if you feel a little nodule sticking out, kind of like a rock underneath your foot, and it's a little bit tender to press on. So press on that, put your thumb on that bone with one hand, then use your other hand to kind of pull the toes that way. I'll show it from a couple different angles. On the top of the foot, you have the fingers together, and you're just rotating like this. Or from the bottom of the foot, thumb on the navicular, and you're just rotating the cuneiform bones, which are the next bones in line on that navicular. Now the next exercise is very similar, you just move down to the cuneiform bones. And there's a row of 3 of them. We're going to treat them all as one just for this particular exercise. The medial and the intermediate ones are the ones that most often are problematic, but you just put your thumb there, and then it's very much the same exercise, just a different joint in the foot. So moving the metatarsals now on the cuneiforms. And again, you'll know if you need to do this if it kind of sticks out on the bottom there and it's a little bit tender. Now on the outside of your foot, coming off the heel bone or the calcaneus, you've got a little bone down here called your cuboid, and that joins with your 4th and 5th metatarsals over here. And so you can do a very similar exercise, just pressing up on the cuboid with your thumb and then moving the outer side of the foot downwards. And that all helps kind of passively reform the arch in your foot. Again, if you're pronating too much from your forefoot, often because you don't have enough rear foot pronation, it's going to flatten the arch out, which is a big contributor to plantar fasciitis and other types of bottom of the foot pain. So now that we've passively gotten the arch moving a little bit better, got the joints in your foot moving a little bit better, now it's time to actively maintain that arch. And so to do that, you're going to use some muscles in your foot, the deep intrinsic foot muscles, as well as a muscle that runs along the inner side of your ankle called the tibialis posterior. And to do this, you're going to scrunch the toes of your foot and then kind of scoop your foot inwards like this. So it's a scooping motion this way, curling the toes and kind of sweeping inwards like that. You can do this pretty much anywhere. You can do it if you're working, kind of sitting underneath a desk. You can do it in shoes or out of shoes. You can cross your leg and do it this way. But these activate the muscles that dynamically maintain your arch. And that's important when you're walking because you need to have the muscle strength to maintain the arch height. So now we're going to move up to a standing position. And next is to maintain that arch height while you're balancing on one leg. So do that scooping exercise that you just did. Hold it there. And then try to balance on one leg while maintaining that arch height. If you need to lean on a wall or hold on to a wall at first, that's okay, or touch down with the toes of the other foot, that's also okay. But eventually you want to get to a point where you can kind of maintain that on your own. Now, finally, you need to be able to take a step without allowing your arch to flatten down too much. And a very common thing that happens is as people load weight out on their foot as they're taking a step, the arch flattens down. And then as they go through, they don't unflatten it enough to be able to have a rigid lever to push off. So to help with that, we're going to do a calf stretch. But many people do calf stretches wrong. They allow their foot to pronate, which kind of plays into the problem that you're trying to correct. So to help with that, you want to do that scooping motion again, create the arch in your foot, then take a step and hold that stretch for about a minute. Now you should keep the arch lifted, pretend there's a thumbtack underneath there, and you don't want to step down on it. You also want to make sure that the heel stays on the floor. So you don't want to let it come up like this. You're going to keep the heel flat on the floor, arch lifted, and then hold that position for about a minute. Now you can turn that into more of a dynamic exercise where you scrunch and you try to maintain the arch as you're walking. So scrunch, take a step, stretch the calf, scrunch, take a step, stretch the calf, scrunch, take a step, stretch the calf. And that becomes more of a functional exercise that translates directly into walking. So hopefully you found this video helpful. If you have been dealing with plantar fasciitis for a long time and it hasn't been going away, many of the exercises in this video are very similar to the manual therapy techniques that we do here at the clinic. And so if you do need more help for plantar fasciitis, I'd suggest connecting with an orthopedic manual physical therapist near you. And if you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. But no matter where you're watching this video from, if you found it helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.